The dementia early detection is intriguing because we're seeing more and more um, dementia, Alzheimer's diagnoses in 30s, people in their 30s, certainly 40s, in the past 10 years. Because of this more and more dementia in earlier ages that
Yes.
we're seeing, in fact, there was an article a year ago about that. Would this be something that might actually want to be used as an annual screening test for people when they go in for their annual physical exam?
Yeah, so the question was, can you do this on an annual basis, given the fact that there is uh, a, a drop in the age group of people who are coming down with cognitive decline? And as this is noted, in other words, we all know that cognitive decline begins up to 20 years before it actually manifests itself. I mean, there are physiologic changes that occur much earlier than clinical manifestations. That can we actually pick something like that up using this system? And the answer is maybe, depending on how profound your physiologic change is, but you can certainly track a patient with this. And if there's a suspicion, and you write it down as a potential ICD-10 code for cognitive dysfunction, Medicare and insurance companies follow suit, allow 2 tests per year to follow this. So, I mean, and the CPT codes are straight, twice yearly. So yeah, and it's very appropriate use, because there's no other way that I can even imagine. You can't get a freaking PET scan, and if you did get a PET scan, you can't understand what the heck it is anyway. So yes, you can use this to track cognitive processing, and then you can continue to track and intervene appropriately. And yeah, a very appropriate way of using it, and that's the way I use it. But I do it more often than twice a year, because what I'll do is I'll start intervention and then have them come back a month later. I only have like 2 or 3 interventions, so they're either going to work. And I would say that my interventions work about 60% of the time. And I'm really, really frustrated why they're not working more profoundly. And then you have to just dig more deeply into the metabolic aspects of the patient. And I'm not going to even go into the genetics.